Now, one of the words that we're hearing all the time is partnership. And with the number of coronavirus infections rising daily, government is escalating new efforts to bring the outbreak under control. South Africa's private healthcare group Clinix has jumped on the bandwagon and is with the Gauteng Provincial government in supporting communities in the fight against COVID-19. Joining us via Skype is Clinix Deputy Chief Executive Officer, Dr. Dumani Kula. Good afternoon to you and welcome. Now, you're either on the front line or about to be on the front line of the escalating fight against coronavirus. Are you optimistic right now that we have this under control?
Good afternoon, Jeremy, and good afternoon to your viewers. We are optimistic that we are doing as much as we can under the circumstances to get ready. I think, as you would have seen globally, this has really been an immense challenge, and it's really difficult to call, in terms of how ready we are. And I think all the efforts that we're all putting in now, working with government, is to make sure that we can flatten the curve, because really that's our best chance for the healthcare system to cope.
And you'll agree, obviously, with the Health Minister, Dr. Mkhize, when he says where we are right now on day 12 of the lockdown could conceivably be the calm before the storm.
It could well be, but we are hoping, that this is not going to escalate any further, because, as I said, our healthcare system really will not be able to cope. And we're doing the best we can. We're getting all the equipment that we need, whether it's ventilators, we're getting all the personal protective equipment that we need for our healthcare workers and all of our staff to make sure that we can protect them. We're getting our ICUs prepared. So I think we're taking all the precautions that are necessary so that we are ready should the situation escalate.
When you say that you're getting your ICUs prepared, what would you be doing?
So Jeremy, as you know, the distribution of cases is that most of the people who have got COVID-19, they do not have any symptoms, and certainly they do not need to be in hospital. But there is about 20% of the people who are infected who then require to be hospitalized. And of those 20%, there's about 5% who need to be treated in ICU. And then because this affects particularly the lungs, then there's quite a substantial percentage of those patients who then need to be ventilated. And the challenge, really, what we've seen globally, the reason in Spain and Italy, and now also the US, they have got large numbers of people dying. A lot of it really is not so much that the virus itself is deadly, but that this healthcare system is really not able to cope with the demand of patients coming through the casualties and the ICUs. They just do not have enough ICU equipment. They do not have enough ventilators, and that's really the push. So when we're talking about our ICUs being prepared, and this really is about freeing up space in the rest of the hospitals, we are looking, if necessary, that we will free up more space in the other wards, so that if there are critically ill patients that need to be treated, that we're able to treat as many people as possible.
I want to talk to you about your cooperation with the local transport department, but just one more question as far as the preparation of ICUs are concerned. We know around the world, particularly in Britain and the United States of America, that there is a crucial and critical shortage of ventilators. Would it be any different in this country?
Not at all. We will probably have an even worse shortage. Of course, there's the issue of private versus a public sector, but the estimates that we have done both within Clinix Group and also looking at the entire system is that we definitely have got a shortage of ventilators if we're not able to control how quickly the virus escalates. So I think we definitely would not be spared. If the likes of the US, the likes of the UK with stronger healthcare systems, if they have not been able to cope, I don't think that we can say that we'll be able to cope with that kind of demand.
Which is articulates the point that it's absolutely critical that people, including cabinet ministers, stay at home and stay safe. Doctor, the nature of the assistance that your company is then lending to the Gauteng Provincial government, I understand it's with the transport department. What are you doing?
So our hospitals are in the middle of the townships. We are in Soweto. We've got 2 hospitals there. We've got a hospital in Vosloorus as well as in Sebokeng, up in Mafikeng, and in the Joburg CBD. And our hospitals have traditionally and historically been in the townships, since the 80s and the 90s. And really the emphasis has been to bring quality healthcare services and make them to be closer and accessible to the people. We are often actually very close to the taxi ranks, which are the transport hubs in the township. And so naturally for us, really it was important for us to be able to work with the transport department, and so we're delighted to be able to partner with the Provincial Department of Transport under the leadership of the MEC Mamabula. We're working with the taxi operators and just to make sure that the call, to make sure that as people are traveling in the taxis, that can make that as safe as possible. So we've given out, sanitizers. We've given out thousands and thousands of liters of sanitizing a liquid. We've distributed a lot of information for education purposes. We've also been providing support with respect to some of the personal protective equipment that is required. For example, the surgical masks, as well as the gloves that are needed.
And we salute you for those efforts. The Deputy Chief Executive Officer of Clinix, Dr. Dumani Kula, thank you very much for joining us.